I would definitely say I was an emotional eater. My work was very stressful, so I used food as a way to comfort myself.
My family is not a heavy-set family, except my dad, but I have always struggled and always wanted to be something else, but never could get there.
My doctor kind of was like, hey, look, you're not super unhealthy, but, your results are a little off. You could stand to lose a little bit of weight.
I've used Weight Watchers in the past. I've used, any diet there was. I definitely tried it. So tried it, failed, tried it, failed.
Over the years, I don't know how many times I've been to different programs, tried different things. Nothing ever stuck.
We don't need to necessarily put you on any medication for high cholesterol or anything like that now, but if you keep doing what you're doing, we may be heading down that road.
And I went to a nutritionist first, and lovely lady, I sat with her for an hour. She gave me a plan, a diet, a list of do's and do nots, and sent me home for a month. I went home and I cried my eyes out and said, I can't do this. I can't do this.
I'm the kind of person who wants to understand. I want to know why. I don't want to be told what to eat. I want to know why.
The number one most important thing that I teach my clients is right off the bat, food is information.
So we need to do something differently. We need to say, I'm worth it, and this matters, and starting today is better than starting tomorrow.
And I felt that a holistic perspective was much more complementary to my way of thinking, my way of seeing myself, and my way of living.
I have become aware. I have become aware of what I eat and how it affects my body.
So now I'm much more focused in terms of the food that I eat on how it's going to make me feel.
So it's not another diet that we give people. We are along with them. We're like partnering up on the journey of learning.
It's somebody who's encouraging you and keeps working with you.
And I think that probably is one of the most important pieces of having a health coach, is having that accountability, having that support.
When I see that what people are taking into their personal lives is working and working long term, that to me is the biggest blessing.
The greatest joy that I have is just seeing people participate in their lives with more confidence and get to a healthier, more active, more positive place.
And I think that's what's fulfilling, is to see that shift that happens in my clients, is that the aha moments of, oh, that's why I feel that way. Oh, that's how I could do it differently.
Not only was this a physical change for me, this was so much more than that, and how I feel more successful at work. I'm sleeping better, I'm happier, I'm able to be a more active participant in society, in my friendships, my relationships, and things like that.
My clothes feel better. I'm buying new clothes in smaller sizes.
I sleep better, I feel better, I exercise, I have gotten rid of medications, blood pressure medication, cholesterol medication. Everything about my life is better. It's the truth.
I'm Michael DeSanti, and I'm a health coach.
I'm Deanna Lennon Glazos, and I'm a health coach.
I'm Jeanette Bonnet. I'm a health coach.
People are tired of being poorly treated in the medical system. They're tired of having the answer to their health concern be more pills, more prescriptions, without really knowing the secret of high-level wellness, how to access feeling well, losing weight, and having a wonderful life. And that's where we come in, and hopefully that's where you come in to make a difference in the world.